Welcome back to another episode of Spilling the Tea with Dr. T. And your host, Gabriel.
And I'm your other host,
T.
T. This is not the name.
And G.
Right. Spilling the tea with Dr. T and G.
G.
Maybe this is
G.
the name.
Who knows? We can do anything we want in life. Freedom.
Anything.
It's in the Constitution.
So I've been wanting to do a podcast or a show like this for 2 years now.
Since we know each other.
I like to talk, and I like to talk about health-related stuff.
And I like to ask questions.
And you do. You ask great questions.
Yeah.
We actually tried to do something similar to this 2 years ago.
Yeah.
We filmed content. It was our first time ever trying anything like this.
We started with the empty white wall and
No
a few
lights.
stools.
Some stools,
Bar stools.
a cheap camera.
Cheap camera. And then we got another cheap camera.
Yeah, and then we created some finished product that we like, and then we sent it out to get feedback and to see if anyone was interested in working together.
And they said,
Interesting.
there's a lot of work to do there.
Yeah. And then we did get an offer to do a podcast.
And this is our all-stars.
This is our all-stars, because the last podcast was great, but I just felt like it wasn't as focused on health-related content as I wanted it to be. And I feel like when I look for health-related information to tell patients or to give as resources, I don't see anything out there that is a little more relaxed and a little less intense and really tailored to the patient population that I work with. And so I thought, let's just make our own and create a place where people can come that have questions or just want to learn new health related information. They can ask us questions and we can make more content to deliver to them. So
In the meantime, I can learn a lot with you.
yeah.
And we can discuss a lot of health-related topics.
Yeah, it's really crazy to me how much you already know just from us working together and things that, I forget what is common knowledge and what is not. So having you here reminds me of things that I should be ready to answer, and maybe some questions will be similar to what other people have.
Let's dive into whatever topic we have to discuss today.
Yeah, so today we're going to talk about DoxyPEP.
Wow. It's funny because when you say DoxyPEP, I think it's the first time that I hear it. Every time I saw the term DoxyPEP, I read it, and I always read DoxyPrep.
Yeah.
So I always thought it was more related to prep than...
Right. Yeah, so DoxyPEP is a little... DoxyPrep. See? DoxyPEP is a little different. So PrEP stands for pre-exposure prophylaxis. So something you would take ahead of time, whereas DoxyPEP is post-exposure prophylaxis, meaning you take it later.
Mm. That makes it easier. I'll never forget again.
Right.
So what is DoxyPEP?
So DoxyPEP is pretty much the most revolutionary method for reducing a bacterial sexually transmitted infection that we have since the invention of the condom. Instead of PrEP, where you take it ahead of time, PEP, you take it after. So think of it like a morning after pill, but to prevent bacterial infections. And so it's relatively new. There's still a lot of physicians out there who are unaware of what it is, which means there's even more patients that don't know that it could be a possible option for them to reduce their risk of infections.
Is it a pill that you take daily, or you take only the days that you're going to have sexual intercourse?
You don't take it ahead of time, right? So you would need to have it on hand afterwards. There's some confusion still around how often you should be taking it. Some literature says you should only take it once in a while, as there are risks and side effects that can occur if you take it too often. And others say you can take it every time you have unprotected sexual intercourse.
When you talk about risks, what do you consider a high-risk sexual behavior?
Yeah, so DoxyPEP is recommended for people that are at high risk of developing an STD or have high-risk sexual behavior. And that's really for anyone who is having unprotected sex with someone who is new or they are not aware of their health status. So it could really be anybody.
Because every time you read this term, you think, oh, they're having sex very often, all the time, strangers.
Yeah, that's the problem with these terms like high risk sexual activity, or they really make you feel like those patient populations are evil or bad or
the stigma,
deviant. Yeah, stigma. Of course, the queer population is often shuffled into what's considered a high risk sexual encounter. People assume that gay men have more sex than straight men, and that's
Yeah.
actually false. There's no clinical study, there's no data that supports that gay men have more sex. The problem is that because gay men represent 1 to 2% of the
Oh,
sexually active population, there's a very small pool. So that's why gay men are often put in that high risk sexual category, is because STIs can spread a lot faster in a smaller community. Oftentimes we're considered to have high risk sexual behavior when really it's just a smaller pool of people that we are sexually active with, putting us at an increased risk.
that's crazy. They love to blame the gays.
It's always the gay's fault.
So what is so revolutionary about DoxyPEP?
Yeah, so DoxyPEP is the first method that we've had, again, since condoms that can help reduce the spread of bacterial infections. And what's so revolutionary about it is that it's going to approach the treatment of STI in a prophylactic way, just like condoms would. But for those who don't use condoms or those that aren't interested in barrier methods to reduce the risks, this will allow them to also have a low risk profile and reduce their risk for developing an STI without having to conform to something that they're not comfortable with. Yes, condoms are the most effective way to reduce the risk of STIs, but not everyone is going to use them. As we can see, they've been around for decades and they've hit a steady state for what we can achieve in regards to STD rates by using them. So we need something new to add additional protection for those people who just aren't going to use them.
People use condoms, people use all the methods to protect themselves. Why we're seeing increases in the cases of STDs?
It could be, in my optimistic view, that more people are getting tested. So if you have more people getting
Right.
tested, then you have more rates that are being recorded. But it also may be that we are less educated in regards to our sexual health. We're seeing a culture war take place where people are more against the education of younger people in regards to their sexual health. And we're also seeing a change in how people view sex. You know, sex in the 90s and early 2000s, there was a lot of fear around HIV. And so we're seeing the decrease in HIV rates with the new medications that are out, making HIV much less dangerous and much less of a threat in regards to longevity in people's lives. And so that's all changing too. And so there's many different factors that could be contributing to the increased STD rate. The main thing we need to focus on is how can we curb it and bring it down.
Beyond the concept of what is DoxyPrep, beyond the concept of what is DoxyPEP, what exactly is chemically, scientifically speaking?
Right.
I
So DoxyPEP stands for doxycycline post-exposure prophylaxis. So doxycycline is a generic, very affordable antibiotic you can get pretty much anywhere. It's been used for decades to treat skin infections, STDs, many other concerns. So we know it's very effective and safe. And when you use it in post-exposure prophylaxis, what you're doing is taking 2 capsules, 100 milligram capsules, so 200 milligrams at once within 72 hours of unprotected sexual activity, in the hopes that it will reduce your risk for developing a bacterial sexually transmitted infection. And it's about 70% effective. Depending on the organism, it's more effective against some and less effective against others. But it has been shown to clinically reduce the risk of developing an STD. And so we're trying to make this more well known so that people can get their hands on it and reduce their risks.
And how does the DoxyPEP helps to prevent the transmission of STDs?
Right. So doxycycline in DoxyPEP will work to block some very important functions within a bacteria that help it to replicate and to thrive. You think of it, one bacteria jumps onto you. Your immune system can take care of that one bacteria, especially if it can't replicate. The problem is it can often replicate out of control and cause a more substantial infection. And so the medicine prevents it from doing so your immune system is able to wipe it out before it becomes a problem. What's fortunate too is that the bacterial infections, both chlamydia and syphilis, which are increasing, there's no resistance confirmed to doxycycline. So we know that it's extremely effective against these organisms, whereas there is some resistance to gonorrhea, which has been around for a while. And so there is some concern there, but we are still seeing that doxycycline and DoxyPEP has been effective to reduce the risk of gonorrhea as well.
Well, 70% is a great number. So
yeah, absolutely.
Definitely
better than 0%.
Yes, that's for sure. Are there any different formulations for DoxyPEP?
So some people may be allergic to
Mm.
doxycycline or they may not tolerate it well. It does have some side effects that can be worse for some people. So unfortunately, there's no other alternative at this time. Again, this is a brand new therapy. This is a brand new methodology. We've never used an antibiotic to combat STDs prophylactically. And so some physicians are still not liking this idea because of the risk of using antibiotics in that way. But I hope over time we'll have more options so we can offer that to people who are allergic or not able to tolerate doxycycline.
Prophylactic. What's that?
So when you take something prophylactically, that means you
Prophylactic.
take it ahead of time to
Right.
prevent an
Got it.
infection. Like PrEP is pre-exposure prophylaxis.
Mm.
So you take a medicine beforehand to prevent infection prophylactically. PEP is post-exposure prophylaxis. So even though you've already been exposed, you're technically not infected by being tested, right? Like maybe you've got the infection, right? And it takes maybe 7 days before it becomes positive on a test. And so you take it post exposure and it's still prophylaxis because you're technically not infected yet, if that makes sense.
So both DoxyPEP and PrEP are both prophylactic.
Right.
Because
Like a morning after pill is considered a prophylactic against birth control. Like if it's already happened, it's already on its way and happening, but it prevents it from getting to that point, similarly to how PEP would work.
So if I want to get DoxyPEP right now, is it available at the pharmacy?
So it should be. It's a relatively cheap and highly used antibiotic. You should be able to find it at any pharmacy throughout the nation. You should be able to find any provider willing to at least understand what you need it for. It's, again, very commonly prescribed and most patients tolerate it very well. There are even some telemedicine companies online that you can Google, hey, I need DoxyPEP, and they'll do a full consultation there online and send it to your local pharmacy. So it's definitely worth looking at online if there's a barrier for you to see a doctor in person.
Oh, telemedicine.
Taken over.
Would you say that an average primary care provider is willing to prescribe DoxyPEP?
I would hope so. I think even, the current CDC guidelines say, be considerate of how often you're going to prescribe DoxyPEP. I've seen some guidelines say patients can take it every time they have sexual intercourse, which could be every day. And I've seen other guidelines say, let's try to limit it to once a month so that it reduces the risk of developing side effects or resistance. I think in general, the majority of primary care providers will be okay with prescribing a limited quantity. I just don't see them probably wanting to prescribe it as a daily, at least yet. But every provider is going to be a little different. If you want it as often as every day, I'm sure there's a provider that will be willing to sort of walk through that with you, discuss those risks with you, and there may be others that are more conservative. So I think it's just about the relationship you have with your doctor and realizing that every doctor is a little bit different. There is an art to medicine. It's not so, cut and dry.
You mentioned STIs and STDs. I'm sorry about my ignorance, but what's the difference?
No, that's a great question. They're the exact same thing.
Okay.
STI stands for sexually transmitted infection. STD stands for sexually transmitted disease. You can use them interchangeably. Some people are very specific that you should separate them for different things. In general, they can be sort of used interchangeably. Good question.
I've seen them before in different places, and I always thought they were different.
Yeah.
But they're the same.
They're the same.
And who is the recommended patient to use DoxyPEP?
So the target population of DoxyPEP is really going to be focused on those at the highest risk of developing a sexually transmitted infection. And I've seen different recommendations. The most recent I saw was one company or one organization was recommending that all men aged 12 and up who have had unprotected sexual intercourse with another man in the last 12 months should consider DoxyPEP to be used as needed. Other data I've found is anyone who is having unprotected sex with someone that they are unfamiliar with their health status, or if it's a new partner, they should consider DoxyPEP. So really, it's anyone, I think, who is concerned. Anyone who feels as though they may be at risk for developing an STD should have that conversation with their provider. And we should try to not limit it too far because we want to help the most people as possible.
Yeah, absolutely.
Yeah.
Everyone.
Hallelujah.
DoxyPEP for everyone.
Why not?
Why not? Everyone's protected.
Hey, put it in the water.
Even with those incredible numbers, is there any hesitation within the medical community?
So anytime that there is a new advancement in sexual health, there's going to be resistance. This is the same that happened with PrEP, and certain physicians are just not as comfortable with the taboo that comes along with sexual health. Some providers don't even like to have these conversations with their patients. And so we do see that conservative pool kind of moving and creating hesitation. However, just with PrEP, most physicians are eager and excited to help their patients in their overall health and help them live better lives. So we see that advancement typically occur regardless. What we do want to be aware of is that there is some concerns for antibiotic resistance with doxycycline use as post-exposure prophylaxis. But doxycycline has been used for decades for many different infections. Some patients take it once a day for a week. Some patients take it once a day for a month. There's some patients that take it once a day for 6 months. And so we know you can take it for a long period of time. It's safe to be taken and it doesn't increase the risk of resistance. And so we hope that that large amount of data will help DoxyPEP get widespread use so we can further reduce the STD rates and make sexual health a priority and make it a more healthy place to have sex in the United States.
Oh,
Yeah.
that's wonderful.
Yeah.
How often would you say that patients are able to use DoxyPEP?
So patients can use DoxyPEP as often as they are comfortable with. And I think it's important that they have that conversation with their doctor. Some medical literature says that we should be prescribing it cautiously and sparingly because we don't want to increase the risks of developing resistance to bacteria from doxycycline. We don't want to disturb the natural bacterial flora that we have in our stomachs that help us to digest food. Things like that are certainly reasons to be cautious. However, doxycycline is very well tolerated. Patients take it all the time for daily use over many months. And so, for patients that are at an increased risk, I think prescribing it more generously is going to help them to feel more comfortable, help them to feel empowered, and reduce their risk for STI. And so, I think it's patient by patient, and having that conversation with your own doctor is going to help you determine what's going to be best for you and what's going to be how often you should take it.
Is there a higher amount that can take a day or?
Good question. So there is not a higher amount. You do not want to take more than the prescribed dosage, which is 200 milligrams within a 24-hour period.
That's your limit.
That's your limit. You don't need more than that. Any more than that can cause side effects or concerns. And typically, you don't want to take it more often than every 72 hours, as you can take one dose within a 72-hour period, and that should clear out any pre-existing infection.
Is there a time that you can take? Like, for example, do you need to have food in your stomach? Or you can take anytime you wake up, you take a DoxyPEP. Like, how does that work?
Yeah, so doxycycline can interact with the calcium in our diet. So it's recommended to avoid milk or any calcium supplements within 2 hours of taking it. This is very nitpicky. I'm pretty sure you'll be just fine, but that is what's on the label. You also may want to take it with a snack. Any medication that you take should be probably taken with a snack unless otherwise directed.
Can you take DoxyPEP with PrEP?
That's a great question.
Finally,
This is like the super pet prep. But yeah, so doxycycline and Truvada or Descovy, so DoxyPEP and PrEP can be taken together. There's no interaction between these medications. So often, if patients are really concerned and want to be as proactive in their health to prevent STI, taking both of these together is a great way to do so.
Super protective.
Absolutely. Superhero. Super medicine. Well, I think this was a great overview of what DoxyPEP is. Of course, if you have questions for us, please drop them in the comments below. We would be happy to address those on another video. We're excited to start this journey of health-related content and get to review all the things that patients bring to my attention and I think are great ways to educate people out there in a comfortable, non-judgmental way. Of course, medicine is an art form. We all have our own sort of way of doing things. So talk to your own primary doctor. They may have difference of opinion. That's okay. Let us know what they think. We'd love to hear and learn ourselves. And we look forward to seeing you next time.
And maybe someone has something that they want us to discuss.
Yeah.
Any ideas,
Absolutely.
recommendations, we're open to it.
If you have any concerns or things you think we should talk about, again, put them in the comments. I think we're supposed to ask them to like, share, subscribe, donate, click,
React,
link, highlight.
love. Don't dislike, please.
Oh, you might want to take that out.
Remember, YouTube had that option for a while.
They still have it.
They still have it.
They're going to be clicking that button.
No, I think they would show how many dislikes the video had. They don't have that anymore.
No, you can click dislike, but no one can see it.
Please don't dislike.
Or whatever works for you.
It's a free country.
See you next time. So DoxyPEP. Harry Potter. Severus. Okay.